Welcome back and welcome to day 3 of the Holistic Dog Summit. I am so delighted you're sticking with us here. I'm really had so much fun yesterday answering your questions. Hope we get a bunch more today because there were some really cool topics. Before we get started, I want to give a special thanks to Chi Dog for sponsoring us. Amazing company, fresh diets cooked according to the traditional Chinese veterinary medicine tradition. And then Pets Pimp, I think one of the best values in pulsed electromagnetic field therapy. Well Pet Dispensary from Dr. Rob Silver, a great formulator and has a magic understanding of both cannabis and mushrooms. And lastly, but not least, certainly to Animal Biome, one of the forerunners and the founders in the space of microbiology and helping to fix your pet's gut. So yesterday we had 4 amazing speakers. Dr. Chris Besant with Herb Smith talked about using common traditional Chinese veterinary medicine herbals for everyday use so that you can feel safe and comfortable using formulas to support your pet. Rita Hogan was next with common conditions supported with herbs and also her home emergency kit. If you haven't checked out Rita's book, Canine Herbalist, you should. It's amazing, and she's on a fantastic book tour this year. Next was Dr. Rob Silver about selecting medicinal mushrooms for specific health conditions. So he was able to relate to us some of the basics about functional mushrooms and how to use them safely in pets. And then lastly, Dr. Megan Barrett helped us learn more about natural flea and tick control. And so she had some literally home recipes to help you help your pet stay protected against these pets. Now, today, super cool stuff. Dr. Holly Gans, one of the founders of Animal Biome, talked about supporting your dog longevity by tending the microbiome. So this day is completely devoted to healing your gut, healing the pet's gut, or the spleen in Chinese medicine. It is the digestion. And then next, Jessica Fisher, the Pet Parenting Reset, one of my holistic pet health coaches, discussed using sensitivity testing and rotation and elimination diet to heal the gut. That is a technique I've been using for years, and she broke it down in a simple, easy-to-use fashion. Next up was Dr. Betsy Redmond with Test, Don't Guess, Is it IBD or pancreatic insufficiency? And she discussed some of the differences between those two conditions so that you can help understand what is my pet dealing with, and gave you some of the underlying signs that are often overlooked when trying to differentiate between these two things. And then next up was Dr. Susan Bohr from Chi Pet discussing improving chronic disease with your dog food therapy. And so she discussed some of the concepts of TCVM, or traditional Chinese veterinary medicine food therapy. And then last, but again, not least for sure, is Pet Suitor, otherwise known as Dr. Poop Lady, talking about how microbes could be the key to fighting pet cancer and boosting immunity. That was a really cool conversation because she brought up some of the new research that's starting to be prevalent on the human side that we're just starting to figure out how to apply to the veterinary side. So I have all sorts of time at your disposal. Ask some questions. Let me know what's up, how I can support you. I'm delighted to do so. We had a wonderful day yesterday answering some questions and got into some of the cool stuff. Now, while we're waiting for some of those questions to come through, one of the things that I helped prepare for this summit is a course on healing your dog's kidney holistically. And so that course is available for sale. Again, this year, we will be doing a live question and answer session. So once you've gone through those recorded course materials, you'll get the chance to ask me questions specifically regarding your pet and questions you may have about the course materials. So I think that's a huge value because So frequently, pet parents go to the vet, they get some lab work done, and they hear, "Oh my gosh, I'm so sorry, but your dog is in stage 2 kidney failure." Well, I'm here to tell you it's not failure. That's a misuse of the definition. When it's stage 2 IRIS, which stands for International Renal Interest Society disease, it's a disease, and that's where we need to take action. But so often, many pet parents hear, there's not much we can do for it. Maybe you can try this probiotic. Feed this bag of kidney diet, which is low in protein. And if you've got an older pet, you're going to cause them to lose muscle and become more debilitated. And then come back and see us in 3 months and we'll see if it's worse. That's incredibly frustrating, and it's not true. So there are many, many things that you can do, and that's a lot of what we discuss in the course. So that's fun stuff that was incredibly well received. It was a great deal of fun creating the course last year, and the pet parents that came on it live really had a tremendous benefit. I was so happy for them. Now, while I'm just kind of babbling along here, we've got one more day tomorrow. And what I wanted to do was give you some techniques for at-home physical care. So we had several speakers regarding these concepts. So Dr. Igor Yerman discussed pulsed electromagnetic field therapy for healing. And you probably not familiar with Dr. Yerman. He is Slovenian, but he is considered to be one of the preeminent experts on this particular topic and how to adjust field and hertz and all of this stuff so that the optimal result for a specific condition is achieved. So we talked a lot about the concepts of PEMF therapy. And I think that's important because we're like, okay, this works, I'll use it. But we also need to understand a little more about how it works and why it works so that we can optimize its use for our pets. And then next was Donna Woods. She was talking about using light therapy to help heal chronic diseases. And then next up was Michael Daly, a veterinary technician who worked for me in my brick and mortar practice and one of the first holistic pet health coaches. Before he became a health coach, he is and was a licensed canine massage therapist. And he did a video describing simple massage techniques that you can use at home to support your pet, to relieve discomfort, and get things moving. And then we finished up the day tomorrow with Dr. Jeff Feynman talking about spirituality and symptoms and how to look at those a little differently in terms of the spirit and the energetic world to help support a little bit better. And I think that was so much fun because when our pets are sick, we get so stuck in the label disease and all of the things we should do for it that we forget to tend their spiritual health and our own spiritual health as well. So that was a wonderful talk. Great. All right. So from the Facebook group, that's cool. All right. I missed that one, Jindy. Thanks. So Jane, welcome. Great to see you. You are using allergy season 6 weeks for a dog. And allergy takes 4 to 6 weeks to work. So can you start it ahead of time? Yeah, that's an absolutely great idea. And it depends on what your experience has been. I mean, we're through allergy season at this point. So is everything hunky-dory, or are you still seeing issues with your pet? The other thing I really like is just straight up quercetin and nettle supplement. And that will take action in about 72 hours. So if you need some symptomatic help, that's another great option. Cool. Let's see. So I hope that's helpful, Jane. So from the Facebook group, adopted a Frenchie 8 months ago. She was spayed last July, and 5 months after the spay, she developed spay incontinence. That's not shocking, sadly. What do I use to stop the leaking? So far, we did pills from the vet and then started her on corn silk drops, which is great, but not totally. So any suggestions? Absolutely. So that's a classic example of Spayneuter syndrome. And when I was a young vet, we used to call it hormone urinary incontinence. Now, the pills from the vet likely were something called Proin. And Proin was a weight loss drug that was available over the counter on the human market. And they pulled it from the human market because women were taking it, and sometimes taking too much, and they were creating neurologic symptoms in themselves. And this is so twitches, all kinds of weird stuff. We see some of this as a side effect in dogs as well. So for getting away from those pills. So what would I use? I would speak to your vet about estrogen. And the reason is this: if you remember, we talked about Spayneuter syndrome. When everything is working well, hormones tell the hypothalamus, hey, we're good. We have plenty of hormones now. Knock off the gonadotropin releasing hormone production and then bring us back into balance. The reason that is important in spayed pets, so we're talking females now, is that you get two benefits. One is there's enough estrogen on board to now stop that leaking. The second is that by shutting off that mechanism, if we drop the GnRH production, we also drop the luteinizing hormone production, and that excess levels of luteinizing hormone are what cause the leaking. So we get everything resolved. We've actually got your dog on a better health trajectory. Many of the vets like to use Incurin, which is a patented product that is available. I've not found it to be terribly successful. If your vet is comfortable going back to the good old-fashioned estradiol, which we used to prescribe, and we can still through a compounding pharmacy, often we get down to once a week dosing, and we're actually solving multiple problems and preventing issues. So I hope that helps. The other thing that I've used successfully is making sure that the diet is dialed in. Again, I'm a cooked feeder, so the original Crock-Pot diet, which is lower in processed carbohydrates, has been super successful for so many pet parents. And then using things like Simplex F, which is a glandular product from Standard Process, but it helps to support the entire endocrine system and bring that system back into balance. So that's been super helpful. Cindy, welcome. So your 70-pound dog loves to eat grass and maybe toxic weeds, and he will drool and then lick his paws. So your dog's trying to tell you something, and weeds are not so bad. And indeed, if you're seeing weeds, what that means is that probably that person or you are not spraying herbicides like glyphosate. If your dog is trying to eat plant material, there's a couple of reasons that could be happening. And one is that they may be trying to repopulate their gut. There is a microorganism called coccus that lives on grass and plants, and that's part of a formula called phytospore. So your dog may be trying to ingest enough pediococcus to recalibrate the microbiome, if you will. But the drooling and licking his paws, this is the other common thing we think about when they're eating grass and weeds, that their tummy is already upset. And so instead of trying to stop this behavior, I think it's important to step back a few notches and try to understand why your pup may be eating them. So drooling and licking paws means there's a lot of nausea present. So interestingly, on this part of the paw, on the top of the paw, that's large intestine channel. That helps to relieve stress. On the inside, and actually kind of on the side in our dogs, is something called pericardium 6. And this is a commonly used point in acupuncture for nausea. So if you find that your dog is actually licking on the side of the leg just above the paw, he or she may be trying to tell you, ooh, I am really not feeling good. And so that's going to cue you in to go look at potential food sensitivities, if there's an imbalance in the microbiome, if there's something that's creating irritation in the stomach. And then if he's licking on top of the leg, then that's going to tell you to think more about anxiety. So I hope that is super helpful. Diana, welcome. Frenchies, boy, we love these guys. Fortunately, they are not they have genetic issues. So her Frenchie gets an itchy back and keeps going under the bench to scratch it. He doesn't seem to scratch anywhere else on his body, and could be related. Um, he's raw fed with plant matter. Already did elimination diet, so only gets proteins that work. So there's a couple of things to consider. It may be that he's itchy. The other thing, if it's one particular spot in the dog's back, he may have a hemivertebrae there. And what that means is that all of these brachycephalic dogs, so Frenchies, Bulldogs, Boston Terriers, have something where instead of a nice block type vertebral formation, they can have a V wedge. And so that's going to create some nerve root discomfort, maybe itchiness. So if you talk to people that have had chronic disc problems, they may tell you that there's a spot on them that really itches, and this is an inappropriate nerve signal to the body. So what I would do is kind of figure out, is he itching because his skin itches? Is he itching because there's something in his back that bothers him? Or what specifically is going on? And if you're doing an elimination diet and you've checked out the proteins, that's great. There's a couple of other things that if you say, oh, well, this really does seem more like an allergy issue, I would encourage you to look at the plant material that you're feeding, and also the method of presenting the food. So when we talk, and this is more of what some of the speakers are going to talk about today, when we look at the spleen in terms of traditional Chinese veterinary medicine, this is the organ that does the bulk, that has been assigned the bulk of the digestive processes. And the spleen abhors cold and damp. And so if we think about raw food, it is cold because it's not cooked. There's no energetic heat in it, even though the protein itself may be a little bit more warming. And it's damp because it is raw. So this is where you may want to experiment with, does he do a little bit better and less itchy when I present him with a gently cooked version of the food? And maybe he needs a little help with his microbiome as well. So plant material is great. That's great that he's seeing a chiropractor. And so there's a cue, right? Does he fire dog? So cooling is good. So balancing the temperature. So when he gets that chiropractic treatment, does the itching go down? And that's going to help you localize, maybe this is a back problem versus an allergy problem. So I would experiment with that and see if you find a different set of answers. I know that raw is the thing that's really popular right now, and it works well for many dogs, but there's many dogs that it doesn't work so well for. So experiment with cooking method as well. Hope that helps. You are very welcome, Diana. All righty, cool. Patty, how are you? Hope you are well. Your 15-year-old diabetic dog is getting started on fecal microbiome transplant therapy. That's awesome. But she's on Royal Canin glycobalance. And when you tried to switch to fresh diet, her sugar weight went way up. So I think what I'm not sure about is what is the diet you switch to. So there's a lot of fresh diets out there, but if we compare, say, the farmer's dog to something like Goodness Gracious versus home cooking, farmer's dog has a very high carbohydrate content. And so for a diabetic dog, even though it's a better step than kibble, that would make the blood sugar go up. Now, if it's Goodness Gracious, which has virtually zero starchy carbs in it, that may be a better standpoint. And then the other option would be a keto version of a home cooked diet. And indeed, if there's been no problems with pancreatitis, because keto is going to be high fat, we need to make sure that the dog can tolerate this. The other way to do this is to use a more of a legume-based diet. And the deal there is that the beans are essentially slow burn carbs because there's a lot of fiber. It prevents these blood sugar spikes. And so good for you. mostly keto, but lower fat. So that's where you may want to actually shift her into keto. Um, that may make a big difference. And so when we look at the Keto Pet Project, what they were saying was nutritional for dogs was at about 65% fat in terms of caloric. And I do have a recipe for the original Crock Pet diet for keto. And then and I think you can do a calculator on their website still as well. Um, this is where fat actually may start to make a difference because you're going to shift her from being a sugar burner into a fat burner. And that helps to reduce insulin resistance and also that's just crazy. I'm so sorry. If she's had pancreatitis, that may be why, but I think unfortunately the 60s and 70s did us in and vilified fat when it's actually an essential nutrient. So this is where you may need to take a deep breath. And if you're not quite confident, this is where working with a holistic pet health coach could be super useful. And there are a multitude of fats. So you could use things like coconut oil if there's no history of pancreatitis, butter, tallow. I use olive oil quite a bit. We'll use grapeseed oil because we're not adding it when the diet is being cooked. There's a myriad of them, but you want to make sure that they're regardless cold pressed if you're using vegetable oils, and then add them after the food has cooled down. Because what we don't want to do is shift the beneficial properties of vegetable oils into potentially toxic ones with cooking. Wow. Y'all, I'm feeling you. It's like what's going on out there with veterinary medicine either. So Jackie, welcome. Glad you're here. Now, 3 surgeries in 3 months, and he's now on 6 weeks of Sinulax antibiotics. How do you support? Well, here's the difficulty. Now that you have already started the antibiotics, the research actually says that if we start probiotics along with the antibiotic when they start, then we can help protect the gut. If your pup's already been antibiotics for a little bit, we actually diminish the return to normal of the microbiome when we give after antibiotics have started. And I know that's like, really? Yeah, I'm sorry. I used to say the opposite as well. So I would encourage you to do this. Use things that are going to support gut healing. So that, for instance, would be fermented foods where you're going to provide some probiotic and we're going to help nourish the gut a little bit better. And then things that will heal the gut and protect it to some degree. So fulvic acid, humic acid. There's a product called Carboxy on the human side that I like a lot. Actually, a company called Pet Amp that's developed sort of a more pet-sized version of it. And then there are things like Digestes, that's also a human product that have been shown to help heal and seal the gut over. So it's kind of a process. And I'd also be worried about the surgeries, what they were for, what's going on. And this is where I think it's important to really get to working with somebody that can support you. Wow, I'm so sorry. All right, let's see what else we got going on here. Thanks, guys. I'm really enjoying the questions. Glad you're on here with us today. Era, hope you are well. You've got a terrier mix, and he's had a lot of gut issues. He's doing better, but still not 100%. Lots of black spots on the belly and also bright pink. So one of the things I would definitely check out is make sure there is not a thyroid issue along with everything else. So that black hyperpigmentation makes me worry about thyroid dysfunction. And then in terms of gut issues, I'm not sure what you're doing, what you've done. I would always suggest go check out Jessica Fisher's talk today about using sensitivity tests and then doing rotation elimination diet. Um, Poor buddy. So um, I would check that out and start following down a path like that to help finish things up. You could look at other types of probiotics, fecal transplants. So one of the probiotics I really like is a human one called Megaspore, and the reason is that the goal with it, it's sporulated, and what that means is that there's a good chance that those bugs will actually reach the gut instead of being broken up by stomach acid. And then fecal microbiome transplant appropriate at this point, and then making sure you've really got the diet locked in terms of feeding lots and lots of variation, lots of plant material so that we can or something for the bugs to eat. Cool. Susan, welcome back. Good to see you. Uh, and I think, yeah, good. I'm glad you've done some research. Yeah. Uh, Armor thyroid, I can't remember which one is working the best right now, but I think that's a great idea. How do you know if her body is converting T4 to T3? Well, so what you should have seen in, like, if your vet did a complete thyroid profile looking at TSH, T4, free T4, T3, free T3, and the thyroid autoantibodies, is that once you've started on the thyroid, the siloxane or some other, you should see that the T4 numbers are coming up, but the T3 numbers are as well, and TSH is dropping down. So that's going to help you know that things are really working well. On the human side, they test for reverse T3, meaning there's a form like stereoisomers, right? So there's T3 and then there's the reverse of it. So the deal is that even though these molecules are similar and they can both sit on the receptor, this one works, this one doesn't. And so in that situation, it's like you've got your foot on the gas, but there's nothing happening. Let's see. Good questions, y'all. Patty, if yeah, MTHFR mutations, it's less possible. And if you go to MBARC, that's a great place to get your dog's genetics sequenced. And they've got some online information. MCT oil is a little difficult. So I'm not sure why the vet said the pancreas was in horrible shape. But again, if your pup's ever had pancreatitis, coconut oil and MCT, which is a derivative of coconut oil, can really create some problems. Now, the interesting thing about MCT oil is that at small doses, this can actually help to induce ketosis. And so that's really tough to use. So butter, ghee, tallow, lard, olive oil, grapeseed oil. There's a whole host of them. If you use using vegetable oils, look for the cold pressed stuff because many of the vegetable oils are extracted with hexane, and that's not something we want for our guys. Right? Cool. And Jackie, your pup's got chronic ulcerative periodontal stomatitis. Oh, that's awful. And that's really tough to deal with. So that is weird. That's usually more of a cat thing, but there you are. So, and I'm assuming we're talking about a dog and not a cat. Correct? But if all of the teeth have been extracted to help prevent that, I'm curious as to why the antibiotics are being used. Because generally, when you remove the teeth, then things get better because that source of infection has gone. Diabetic dog, difficulty getting the diabetes under control as well, because that chronic infection is a source of uh, chronic inflammation, which is going to make it more difficult for the rest of her body to respond to sugar, glucose. Use something like laser therapy, pulse therapy, red light, reduce the levels of infection. I used to do that for ladies who was 22 and not stable or anesthesia, but this helped her comfort level come under control. Um, so that's an option as well. I hope that makes sense. And user, you're feeding your dogs green beans with a touch of olive oil with kibble. Can't feed raw. I wouldn't recommend feeding raw. So I would suggest you get a balanced diet though, and you you can go to balance it. I'd love for you to go to drruthroberts.com and get the original Crockpet diet. And so there's a couple of things you can do. One is a video I did with Tanya Baxace, one of my stick options for and keeping the ticks off. Anywhere from talent tags, we've been essential oils, all sorts of things. She had some really unique suggestions. And then as terms of the dog modulatory, and what this may actually be helping your dog's immune system do is to learn how. Cool. Let's see. Where am I? Greer. I'm giving my dogs and here. So let's see. Okay, so this YouTube user. Yeah, I talked about this one. So I would actually, this is where I would suggest doing a really balanced home cooked diet, like the original Crockpet diet. And then that way you're adding a balanced diet to a balanced diet so that you know that what's going into the bowl is good all the way around. Cool. And all right, so Rana, great question. Now, milk thistle, liposomal glutathione, TUDCA, all of these supplements push the liver to dump stuff. If you're using a relatively light dose of milk thistle and you're not particularly concerned about things like heavy metal toxins or other toxins, you could probably get away without using a binder. But I think that we're in this situation where we need to do a daily detox for these guys in some form or another. So one option is a fulvic acid, humic acid supplement. Like I said, carboxy is a great one. There's a new company called Pets Amp that's produced a fulvic acid, humic acid product. The upside of this is that you don't have to give it away from food or other supplements, only prescription medications. And because it's able to get into the cell to retrieve the toxins that are present there with the fulvic acid, as well as stay in the gut to absorb and adsorb toxins there, it's a great option, especially if you're using things that are pushing the liver. So functional medicine on the human side, they call this concept pushing catching, right? So we want to push stuff out of the system we don't want, but we want to catch it so that it doesn't recirculate through the body. Great questions. If you're using something like clinoptilite, which is another type of molecule that's derived often from clay, or something like activated charcoal, bentonite, which I would not recommend, or scheelite, I would not recommend either because there's contamination issues with those products. Those you do need to give at least an hour away from food and 2 hours away from supplements and other medications. Cool. Um, Jane, welcome. Good to see you. 4-year-old Sheltie, cooked diet, made by a nutritionist, I'm guessing. She's having episodes of soft stool and mucus for 3 months. So FMT and Adored Beast Healthy Gut Protocol helped but didn't resolve, waiting for results of animal biome. Anything else to do? Yes. So go listen to Jess Glacier Peak's pet wellness scan, and that will give you an idea about any food sensitivities that are present. And then from there, you can develop a rotation and elimination diet. And the idea is this, that if we present the GI tract with different food antigens every day, the immune system does not have the opportunity to create antibodies to what your dog is eating. So it's one of those deals where it's going to take a little bit of time, like somewhere around 4 weeks to maybe 3 months total to really get things back on course. But this is going to help your dog's gut heal and stop the immune response from the immune system based on what your dog's been eating. So I hope that helps. And that's the thing. If you've already doing this route, so the animal biome test looks icky because something is still not balanced correctly. The other thing you could consider is there is innovative pet labs, and they are doing testing that's more along the line of functional medicine. So is there leaky gut? Is there pancreatic insufficiency? Is there evidence of inflammatory response? That's another way to kind of get more information. Cool. And Diana, good to see you. So he's fed twice daily and definitely enough. So it's one of those things. So some of these sort of food over enthusiasm, shall we say, can be due to, sorry, glitched a wee bit, can be due to issue and a point of control. So it's like, I want your food too, and you're going to obey me. Or it could be that he's just, part of the deal is he's just not digesting the food very well. And so he knows he's going to be hungry later. So he tries to just grab everything possible. Great. Suzanne, I don't do phone or Zoom consults. So what I've been doing for the last 2.5 years is training people to be holistic pet, but there's 105 parents. The ability to have somebody to talk, been working, what do I do next? And it's so hard sometimes because we have a great holistic vets out there, but there's only 1,500 members of the American Holistic Veterinary Medical Association. The coaches are trained to work with you and to help support you with your veterinarian so that your dog gets everything it needs. Come and click on the tab that says find a coach. But I think, this is where you all are trying your hardest to figure stuff out, and you're trying based on the issues. Hopefully this is, but this is the thing. This is why this program was developed, to help you pet parents get the answers and the support that you need. Cool. Um, yes, and it is being recorded. Let's see. What else? Sure. Let me jump off and jump back in. Hey, Jendi, are we doing better? Hopefully this is working better, y'all. Apologies. Here and everything is beautiful. So here we go. I forget where we were. I think I was talking to talking about us. Susan had asked about Zoom or phone consults. So the deal, I don't anymore, and the reason is that I've spent the last 2.5 years developing the holistic pet health coach certification program for this very reason. There's one of me, and there's hundreds and hundreds of you, and so this way, I have trained now 105 coaches to be able to help you get the help you need. And they are trained to uh, questions, help you understand where your pet is currently, and then walk you through all of talking about. And I think it's so critical for you to have access to someone that can help guide you through your pet's health journey. Because it's not just one, uh, uh, it's not just a once and hope that makes sense. If you want to learn com and click on the find a coach. Cool. Uh, Thanks. Glad all is good. DFW is a place I haven't been for a while. Right on. And about work on longevity. What are the if we think about what are the underlying components of chronic disease, there's the integrate specific issues. We're looking at things like, okay, sorry guys, I'm not sure what's going on with my internet today. Let me see if I can reconnect and go from there. Hopefully this is a little better. Is that helping, Jindy? Cool. Okay, good. Now maybe we're cool. All right. So preventing problems, work on inflammation, the ability to assimilate and digest nutrients, and then lastly, the ability to detoxify. So if you've got an 8-year-old Frenchie, what are the problems this guy might encounter as he goes through life? Arthritis, spinal disease, because they tend to have malformations. So that's where joint supplement would probably be helpful. along with an omega-3 fatty acid supplement. We want to make sure that the microbiome stays super healthy, right? So that's going to be making sure that the diet is dialed in and appropriate for this dog. One dog may do great with raw food in a household. The other dog may need cooked food. So you have to really figure out what's best for your pet. Um, and then one of the big things we are working on is detoxification, because we're living in a toxic world. I mean, for goodness sake, children are being born today with DDT in their cord blood. DDT is a pesticide that was banned in the United States in 1968. And so why is it still in the cord blood of children today? And that means that from their connection to the placenta, it's because DDT and glyphosate and plastics and PFASs and all the bad stuff is in the water cycle. And so what that means is that even though we haven't used DDT in almost 40 some years, it's still there because it's in the water cycle. When it rains, it comes down out of the cloud. It goes into the creeks, to the lakes, to the ocean. And as the water evaporates or gets filtered, it goes back up into the atmosphere and comes back down. So the problem is that we, as my mother would say, we have done pissed in the grits. We have made a mess, and we're going to have to live with this because we don't seem to be changing our behaviors anytime soon. So what do you do to protect your pets? Use something like milk thistle, TUDCA, liposomal glutathione to support liver detoxification. And then, so that's the pusher, right? And then the catcher, a fulvic acid, humic acid product, like Carboxy, like Petsam's product. And I think that's a great way to really kind of cover all the bases. If the higher the omega-3 ratio is, the omega-6 to omega-3 ratio, if omega-6s are high and omega-3s are low, then we're setting that dog up to have inflammation. Both are necessary. The other thing is exercise is critical. A water filter is critical, because if we don't allow the toxins to go in the body, then there's less to get rid of, right? So make sure you're using something that will take out plastics, all of the chemicals and the pesticides that I just mentioned. And then spend some time doing nothing with your dog. Turn your phone off, leave it in the house, go outside in the yard and play, and just be present. And I think that helps you out. It helps your dog out tremendously as well. Cool. And again, thank you all for your patience. And Susan, thank you. I'm not sure what was up with my internet. Hopefully it's all chilled now. How do you find a coach? You go to drruthroberts.com and you click on the tab, Find a Coach. And there will be a list of all of our graduates. We've got some filters that we're working on, so it'll be easier to tell what they do more appropriately in terms of aromatherapy, animal communication, all of those good things. So, but go check it out. There are really dedicated people to helping you help your pets stay healthy. Cool. All right. Ruth, yes. It's not about believing in raw food. So let me phrase it to you this way, right? Because it's like, raw, the only way. Kibble, the only way. And what I'm offering you is a middle way. If we look at the teachings of traditional Chinese veterinary medicine, and I mentioned this earlier, the spleen, the major organ associated with digestive function, abhors cold and damp. And I think there's a couple of things in terms of supporting the spleen, the digestive system, from the standpoint of cooking. One is if we cook it slow, and we, like in a slow cooker, a crock pot, then we're able to make that food be essentially pre-digested. And I think that's important for dogs, especially when we're feeding a lot of vegetables, because it breaks down the plant wall, the cellulose in the plant wall, so that all of the nutrients are better easily accessed by your dog. Now, in my hands, there have been a number of clients where their dogs did better on raw. They just did. It suited their digestive style. and what I understand now in terms of carbohydrate metabolism and digestion, I would alter things a bit more. But what I've seen is that we have this idea that raw is the ancestral diet of dogs, and indeed it is for wolves. That's one species ahead of dogs. It's our ancestral diet too, but for two species prior to us. If we think about how we developed with our friends, Canis familiaris, when we arrived, Homo sapiens, Neanderthals were already cooking. And in fact, that's how we think our big brains developed. Sometimes we don't use them so well, right? But what we can then understand is that we were using fire to cook food. As we developed, Canis familiaris showed up. We showed up 50,000 years ago, let's say. Canis familiaris showed up somewhere between 15 and 40,000 years ago. And there's evidence that we were baking bread 30,000 years ago from gathered grains. So the dogs came along with us eating starchy carbohydrates, complex carbohydrates in the form of vegetables, as well as starches, grains, etc., as well as meat and the fat that was available on the meat. Now, everybody was pretty lean back then, right? So the deal is that dogs didn't develop with us eating raw meat. They developed with us eating cooked food. And frankly, they developed eating our garbage first and our poop, which is part of, because that's not very efficient processors. And that's part of where the microbiome similarities between humans and dogs come from. And then later, they ate what we gave them, our leftovers, basically. And then finally, what we fed them intentionally. Now, were they eating a lot of raw meaty bones? They absolutely were. And I think if you go back a few generations ahead of this one and look at, for instance, the work of Juliette Barclay-Levy, she was feeding raw meaty bones. She was feeding some raw meat, but she was feeding a lot of milk and cooked grains. So that's a very different approach from what's going on today. And I think what you have to do is, don't believe me. Don't believe Dr. Ian Billinghurst. Don't believe all of the folks that are raw proponents. Figure out what works well for your dog. And I think that's what's important. Right on. So I'm off my soapbox. And Diana, good for you for using glass bottled water and lots of long walks. Get a water filter, though, because there is an environmental cost to that bottled water. If you have to ship it, let's say, you're using the stuff here. If you live in the US and you're using the stuff from Arkansas, if you live in Arkansas, it traveled maybe a couple of 100 miles. Maybe it traveled 1,500 miles, and glass is heavy to ship. So if you get some sort of a water filter, like a Berkey filter or reverse osmosis, the water's coming out of your tap, having the harmful stuff removed and going straight into your glass and into your dog's bowl. So think about it that way too. Right on. And if you live in Ireland, you can still get a filter. And I know that you've got much better water sources there, but interestingly enough, there was a study last year about contamination. Yeah, you do need a water filter. Contamination levels of mineral waters, and it was pretty shocking. All right, Wendy, you want to move from kibbled and canned dog food and want to try fresh cooked food, but you're feeling overwhelmed. You are not alone, my friend. That's exactly it. So start with adding fresh veggies. So you can do something super simple, like get a frozen blend of vegetables. In the US, we call it Normandy blend. That's broccoli, cauliflower, squashes, and just cook that. Make sure it's well and thoroughly cooked, and mash it up a little bit, throw that and the water on top of the kibble. That's a great way to start. And then if she's got a sensitive stomach, take 10 days to 2 weeks to transition. And that's where, if you're looking for a solution, there's the diet I developed back in 2006. So we've got 20 years of experience almost with it, is called the original Crock-Pot diet. And so there's a great deal of information about how to use that, how to balance it, all of those good things. So go check that out. But take it easy. You don't want to create problems where you've already got mild ones. And yes, you're on the right track. So keep breathing. If you really need help figuring this out, figuring out what foods your pet may be sensitive to, again, listen to Jessica's talk today. Jessica Fisher, one of my holistic pet health coaches, she's going to run down using food sensitivity tests and rotation and elimination diet to heal the gut. And interestingly enough, skin problems start with gut problems. So that chewing at her paws, shaking her head, that's exactly it. And the deal is with the original Crock-Pot diet, it is the magic words every veterinarian likes to hear: complete and balanced for all life standards according to AFCO standards. So there you go. Hope that helps. What else we got going on? Fresh cooked mushrooms, daily dosage for 50 to 60 pound dog. So if we look at the human information, 2 to 3 button mushrooms 3 times a week for humans extends their health span and lifespan by 4 years. So if we backtrack that a little bit and say, okay, 25% of a human dose is a good starting dose for up to 25 pounds. So let's say 50%. So a button mushroom, any of the mushrooms you can get, lion's mane, tremella, all of those beautiful, beautiful things. That's a great place to start. And so you can just do that, cook them and have them as a topper. Cooked is critical because that breaks down the chitin in the cell walls and allows the healthful components to come out of the mushrooms. Sweet. Let's see, what else we got going on? Diana, sensitivity to sweet potato and butternut squash, absolutely. It's a very common sensitivity. So again, this is where using a test can be super, super helpful. So I've liked Glacier Peak Holistic's pet wellness scan for many years, and it's very inexpensive. Relatively speaking, it's about $130 and a great deal of info. And I do know that they will ship internationally as well. And Susan, great. You had your water tested. That's awesome. Surprise, surprise. You had arsenic in the water, not uncommon. And an additional filtration system. So, that's where I think a filtration system, if it's taking out arsenic, chances are good it's taking out other heavy metals, which is amazing. Well water is generally considered to be cleaner than tap water, but not necessarily so. And so that's where, you've already made an investment. You may need to look at what else you need to do. Is that filtration also able to get microplastics out and some of the other pesticides as well? And if you've got an RO system, it should be taking everything out. That's awesome. Jackie, blueberries are great. Here's what I would say in general about food. We try not to give something every day because this is a great way to develop food sensitivities. And so, you could, for a 22-pound dog, 3 or 4 blueberries every day is amazing. Or on a regular basis. Now, here's some other options you could use. You could use cherries. You just got to pull the pit out. You could use blackberries. You could use raspberries. You could use a myriad of things. So look for the different colors. That whole concept of feeding the rainbow. The rainbow are polyphenols, and the polyphenols are what helps improve the diversity and the richness of our microbiome. They're not for us. They're actually for the bugs. So look for different colors. Small amounts of fresh fruit, I think, are really good on a regular basis. So cool. And what else? I think we're coming towards the end. Thank you all for your patience today with the technical issues. We're going to be back tomorrow, same time, to answer more questions and kind of review how things went. One more big shout out to our sponsors, whom without we could not put these programs on. So let's thank Chi Dog. Dr. Susan Bohr is actually speaking today. So Pets PEMF, amazing option for pulsed electromagnetic field therapy. Well Pet Dispensary with Dr. Rob Silver, and Animal Biome, the first and one of the most amazing for microbiome health. Thank you all for coming. So happy to be here with you. We'll see you tomorrow.